Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. We are now live, and today's the time that I get to spend with you guys and answer all your plastic surgery questions, and of course go over new and old plastic surgery topics. So a topic which is actually quite new, so I'm excited about this. We're going to be going over this topic and everything that can be done. And then, of course, I'm going to be happy to answer all your plastic surgery questions. It could be about this or anything else related to plastic surgery. Remember, I am a double board certified plastic surgeon, Duke trained, highly qualified. I can answer any plastic surgery question you may throw at me from head to toe. Okay? But talking about head to toe, you guys will probably all know about the mommy makeover, right? You've heard about the mommy makeover, and this is typically where we're concentrating of the front of the patient, right? So we're typically talking about a breast surgery and the tummy tuck. So that's your typical mommy makeover. Very, very common. This term is thrown around not only kind of, in medical circles, but, in the social media and even in like the, the layman media and everything else. So very common term. The other thing that's very, very kind of common is, dealing with the face and the neck, right? So we do a lot of things to help kind of preserve and improve the face in the neck throughout the years. And everyone's heard about Botox, which deals with like the wrinkles, right? And then you've heard about fillers, which help fill out areas such as the nasolabial folds and the lips. And you've heard, of course, about lipo, when we do some lipo to the chin and try to create a nicer or more defined angles. And you've even heard about things that can help with tightening the skin, such as lasers and Morpheus 8, which are very, very common, and of course, face tight as well. And on top of that, skincare packages, right? So when we're talking about the face, of course, the face is very important. And there's all these things that we can do to basically try to, slow down the aging of the face, right? But nowadays, there are other parts that are becoming just as important, okay? And that's actually the lower half of the body. So up until now, we didn't really have anything that's similar to everything that we do for the face or the mommy makeover. But now we finally have all the tools that we need to really try to make the lower part of the body more youthful as well, and what we're calling the booty makeover. That's right, the booty makeover, okay? So what does that mean? So when you're thinking about the lower half of the body, so I'm not just talking about just the booty itself, but also, the thighs as well. When you're thinking about that, it's not as simple as, say, we thought it was. It's not just, say, putting in a bunch of volume and that's it, right? It's a lot more nuanced than that now. And there's a lot of factors that come into play, and we're learning more and more about each of these factors and then how to treat them in a comprehensive way to really help create a more youthful appearance from the waist down, okay? And so when we're talking about that, we kind of have to break it up into all the different elements and then treat each of those elements specifically if you truly want to have what we call a complete booty makeover, okay? So, of course, nowadays, we talk a lot about shape, and quite honestly, shape is one of the most important aspects of the lower half of the body. And it's much more important, I think, at least in my mind, than volume and pretty much everything else. So back in the day, it was all about volume, right? It was like, Doc, I want the widest hips possible. I want the biggest butt possible, right? And in a few years, it wasn't really ever my style. But there were a lot of people out there getting these really wide hips, really big booties, these what they call vixen looks. You don't hear so much about the vixen look anymore. But back then, the vixen look was all the rage. And so you started getting also like these ant type booties and diaper booties and things like that, which unfortunately didn't last. All right, so now today we're getting a lot of people coming back because they want to come and have their BBLs reversed. And so we're seeing that trend go up, and we're actually one of the #1 centers here in South Florida for BBL reversal and BBL reshaping, okay? Because the shape is really what's most important, and you want to make sure that shape is tailored to that patient's unique foundation, okay? That's what's so important. You want to make sure that all the lines, all the contours are smooth. So you want a smooth contour into the waist, out to the hip, and then back down to the thigh, so that everything looks like it belongs and it's enhanced but it looks like it belongs and not like it's fake or stuck on or surgical, all right? So when we talk about the shape, of course, a lot of patients that come here, they want to have our signature Earle curve and our signature upside down heart, which is practically created here at Pure Plastic Surgery. Now other people are trying to emulate it. But if you want to have that Earle curve and signature upside down heart, then of course what we need to do is typically the Lipo 360 and the BBL. So that's what's going to help with the shape. So you want to go from kind of a squarish, kind of SpongeBob type of look to a nice, beautiful hourglass Earle curve from the front, signature upside down heart shape from the back. Then we have to do that with a combination of liposuction and fat transfer, okay? So for the shape, we're going to be doing your Lipo 360 BBL. And then of course, there are issues with volume. So a lot of times there's just not enough volume. It could be due to genetics, weight loss, post-pregnancy, okay? And so you want to add some volume. And the other part, the other area where a lot of people want to add volume is in the hips, particularly what we call the hip dips, okay? I can't tell you how many bogus videos I've seen out there, bogus trainers, people saying that you can go to the gym and somehow work out your hip dips. Let me tell you right now, do not buy into that. It is physically impossible. There is no muscle in the hip dip area. It's actually called the trochanteric depression, which means it's a depression. There's no muscle there. Okay, the only thing you can bulk up in a gym is muscle. So yeah, you want to make your biceps bigger, you can bulk them up. All right, you want to make the actual gluteus bigger, you can do that as well. But you can't bulk up an area where there is no muscle. You can only fill it, and the best way to fill it is with your own fat. Okay, so volume of course becomes the next thing. So if you want more projection, you want to fill in those hip dips or even make your existing hips just a little bit wider, that's where that comes in. Of course, that's going to be part of your BBL and the fat transfer portion there, okay? And up until now, that's pretty much all we did, right? We didn't have these other tools that I'm going to tell you about here. So yeah, you could have brought out the shape, you can bring out the volume, but what about these other things that are going on? That'll make you look great in a tight dress, or like what do you call it, spandex type of pants and whatnot. But what about naked? People want to look good naked too, right? So you got to deal with these other things. So what about cellulite and dents? Okay, so as I've said many times before, BBL and fat transfer is not a cure for cellulite, and it's not a cure for these kind of very adhesive dents, okay? What causes cellulite and also some of these dents are these internal attachments, okay? These fibrous septae, if you want the technical term for it. But basically these fibrous bands that are attached to the skin, attached to the muscle, and they're pulling things down, okay? And if you have these bands and you don't release the bands, then you can't really expand the skin in that spot. And that's why a BBL is not a cure for cellulite, okay? But now, okay, recently, you've probably heard me talk about this for a bit now. We have a tool that is specific for cellulite, and it also helps with certain dents as well, called Earle, okay? Earle is a terrific tool that has like this little tiny blade, if you will, that goes and cuts these bands, these fibrous septae. It then allows the skin to then relax, okay, and to pop back up and create a smoother contour, okay? So now we can add the Earle to that, all right? Exactly when you do the Earle depends on how many bands we have to cut, because if you have very extensive cellulite, then we'll have to separate these procedures in terms of stages. You may want to do your BBL first and then come back for your Earle later to really smooth out those areas, okay? All right, so now we've dealt with shape and volume, and we've dealt with the cellulite and the dents, okay? But what about the skin? What if we still have some skin laxity, right? The most common for this would be like a weight loss patient, right? You lost 40 pounds, you're in that semi-glutide, right? You did awesome, but then you get semi-glutide butt. Semi-glutide butt, unfortunately, is not just a loss of volume, but you have skin laxity as well, all right? And it's actually a thing. If you look it up, there's like semi-glutide body, semi-glutide face, semi-glutide butt, okay? So it's great, you lost the weight, you're feeling good, you're in shape, you're working out, but you have loose skin, you've done everything else, So what about the skin? So now, depending on how much skin laxity there is, we can treat it with either body tight, if it's a little bit more extensive, because that we're going to do in the OR. We can probably do in the OR at the same time as your BBL, okay? Or if it's not too bad, we can then do what's called Morpheus 8. That's that microneedling with RF energy, okay? So the great thing about the Earle and the Morpheus 8 is that these can be done in the clinic. You don't have to go under general anesthesia. You don't have to do all that fuss. You come to the clinic for an hour or two, and we can take care of it under local anesthesia in the clinic setting, and it can be done by our nurse practitioner or our physician assistant, all right? So Jenny and Natalie, they're super experienced with the Earle and the Morpheus 8, and they can take care of that for you, okay? So now we've dealt with everything that's going on down there. We've dealt with the shape, the volume, the cellulite, and the skin laxity, okay? Of course, inevitably, because everyone's always a perfectionist, they weren't before, but after, they come to do some plastic surgery, then you're looking, and you're looking, right? You're staring at your buttock for hours on end, which you never did before, but now you do. And there's gonna be, inevitably, there's gonna be this little area that bothers you, right? And you just want to you're like, hey doc, if I just want to fill this spot, what can I do, right? And I'm not gonna say, oh, let's go do a whole other BBL, not for like a little small spot. So if you have that one little spot, then Sculptra is the best answer for you, okay? Sculptra is a filler. It's not exactly the same as the fillers that we use on the face, such as your Restylane and your hyaluronic acid fillers. But it works in that, it's a similar concept. It's a filler that's used to just give a little bit of volume to that specific area that's bothering you after you've gone through all this. The good news about Sculptra, again, is also that it can be done in the clinic. So all these three can be done in the clinic, in the Pure Aesthetic Center, by our nurse practitioner or PA. And that can be done after you've had potentially, say, your big surgery. So how would I stage this, right? Okay, you come in and you're like, hey, Dr. Earle, I want that booty makeover. I want to really make this booty as youthful as we can. And I'm like, okay, so we're gonna start with volume and shape. All right, we're gonna start with your Lipo 360 and BBL. Of course, to that we can add, whatever you want to do in terms of the lipo. If you want to do HD lipo, you want to have an athletic look, we can do that total definer, really define the entire body, give you that full athletic look as well. Okay, but definitely the Lipo 360 BBL. We'll work on getting you that Earle curve, that signature upside down heart shape. Okay, and then you can come back to the clinic. Again, no longer general anesthesia. It's done in the clinic under local. Okay, and we can deal with the cellulite, the skin laxity with the Morpheus 8. And if we need to touch up any certain small areas, we can add the Sculptra to that. So combining all these things together in the same way that when you're dealing with your face, you're going to combine Botox, fillers, Morpheus 8, perhaps a laser, and skin cream, okay, to maintain that youthful face so that you look, 45 when you're 85, right? Combining all these things is what's going to maintain the lower body useful for many, many years to come as well. All right? Okay, questions?
I have a really good one, and it's about stretch marks.
Yes, great. So stretch marks is the one thing that I didn't address here, right? So thank you for that. So it's a great question. Unfortunately, stretch marks in the booty area, we cannot make them go away. Really the best that you can do for stretch marks in that area is and we don't provide that here, but there are certain places where they basically pigment them or tattoo them in a way where they're not that visible. Of course, now, yeah, it's exactly like the camouflage type tattoo. That's the best that we can do. Now, if you have stretch marks in your lower belly and loose skin, then of course the best way to get rid of those is with a tummy tuck, because when we remove all that excess skin, we actually remove these stretch marks with the skin that we're gonna basically excise and toss away.
For a breast lift with implant, it's best to get the implant under or on top of the muscle.
So when I'm combining that procedure, so meaning I'm doing it at the same time, your breast lift and your implant, I typically like to put the implant beneath the muscle, okay? So that way the implant is kind of separate from the rest of the work that you have to do for the breast lift, and it's more protected, if you will, okay? There's also kind of more layers between the outside world and the implant itself. And so therefore there's less chances of, say, the implant getting infected or getting exposed. Okay, so when you're doing a breast lift with implant, I do highly recommend to place that implant beneath the muscle.
Is there any filler to feel the hip dips, not necessarily a BBL, just to feel the dips?
Yeah, so I think the best way to fill in the hip dips is with your own fat, okay? I think that's really the number one way to do it. And for most patients, even someone with like a BMI of like 19, we're able to find enough fat to fill in the hip dips. So I think that's really the best option. Now, if you're someone who truly has absolutely like almost no fat in your body, okay, then the next best option does become the Sculptra, okay? And the Sculptra, again, will help give you some volume, but there's a couple things you need to know about Sculptra, okay? Number one, if you're gonna do a significant amount of volume with it, it's gonna require many syringes and then therefore can get relatively expensive. Sometimes to the point as the same cost as a BBL, okay, depending on how many syringes it is that you need. The other thing you need to know about Sculptra is that it typically doesn't last forever. It can last about 2 years, but sometimes after 2 years, you have to go back and kind of fill those areas again.
BBL or tummy tuck first at TikTok?
All right, hey TikTok. All right, thanks for joining us, guys, and that's a great question. So I typically almost always recommend doing the tummy tuck first, okay? Especially if you know you're gonna need both, all right? Because you say muscle separation and weakness and quite a bit of excessive loose skin. It's always best to do your tummy tuck first, all right? You wanna come in, you wanna remove all the excess skin, we're gonna tighten up those muscles, do that diastasis repair, okay? Make things really, really nice and tight so that when you come back for your BBL, everything's gonna end up as smooth as possible, okay? There's a couple myths out there, and let me tell you, they are not true. A lot of people are saying, well, if you do your tummy tuck first, are you gonna have enough fat for the BBL? And the answer is 100% yes. You will definitely have enough fat for your BBL. Remember, when we're doing a tummy tuck, we're not lipoing the entire body, right? We're only doing a little bit of lipo to the flanks and the waist to kind of cinch that in and bring out more of an hourglass shape. But we still haven't lipoed all of this area here in the anterior abdomen. We still haven't lipoed the back. And if we need to, we haven't gone to like the thighs or the arms. So you're definitely gonna have enough fat. Do not worry about that, okay?
How many cc's do you have to go up in size to see a noticeable difference for breast augmentation?
So that's gonna depend a lot on the patient and where we're starting, okay? So for example, if you have already a relatively large breast and I put in, say, a 300cc implant, you may not see a big difference. But if you're starting with a cup breast and I put in a 300cc implant, you're gonna see a very large difference, okay? So that's why we can't just tell you, say somebody says, oh, I wanna go from a C to a D, well, how much volume should I get? So we can't really give you that answer because it all depends on your anatomy and your objective measurements. So in order to really figure out what size implant we should use, we have to combine several things in a process that we call smart aesthetics, all right? So we have to combine your desires along with your anatomy and your objective measurements to come up with the best surgical solution for you, okay? So that means that when you come in, I'm gonna take quite a few measurements from the sternal notch to the nipple, from the nipple to the inframammary fold, nipple to nipple. Basically, we're taking like 5 or 6 different measurements per side to then determine what is going to be the best implant. And the most important measurement of them all is what we call the base width, which is basically the distance from here to here. It's to see basically just how wide an implant your body can take without the implant going off too far to the side or falling into the armpit or wanting to create a symastia going over to the side in this direction.
After the mommy makeover, when do you recommend coming back for the BBL?
Great question. So yes, definitely if you're gonna combine all those, I don't do them all at the same time. So mommy makeover should come first, and then around 3 to 4 months later, you can come back for your BBL. Okay, so that would be the soonest. Of course, if you wanted to wait a little bit longer, that's fine. but 3 to 4 months is the minimum amount of time needed to come back.
Okay. At pre-op for mommy makeover, you have a patient who believe only need implants, but once they get there, you think they need a lift. What would happen?
Yeah, so I would definitely, talk to the patient. I'll have to make sure that their expectations are realistic, okay, and have them understand that for the look that they're going for, they're going to need a lift, okay? Because the issue is if you place an implant and there's excessive ptosis or droopiness of the breast, and that part is not dealt with, then the patient's going to end up with what we call a waterfall or Snoopy deformity, meaning that the implant is going to be up in the chest where it's supposed to be, but the breast is going to be falling over the implant, and that's why we call it like a waterfall. Or you guys remember Snoopy, the cartoon, all right? Or a Snoopy deformity, because the breast is falling over the implant, and you don't want that. That's not a good look. So we talk about all that. We discuss the pros and cons, and of course, typically I would recommend doing the breast lift with the implant or not doing anything at all.
What's the max fat amount you can transfer to the buttock area for the BBL?
So here in the state of Florida, the max amount of fat that we can remove, okay, is 4 liters, okay, in what's called an office-based surgery setting, which is what we have here at Pure Plastic Surgery, which is what most of the plastic surgery clinics out here is office-based surgery, meaning not done in the hospital, okay? So your office-based plastic surgery setting, the max that we can remove is the 4 liters, and therefore the max that we could place is 2,000 per side, which would be equal to the 4 liters, 2,000 and 2,000. Now, having said that, it would be very rare that we can actually put 2,000 liters per side, okay? That's a lot of volume to be placing in the buttock, and most patients are not able to accept that, even if they wanted to, because the skin can only stretch so far, right? So skin has a property called elasticity. It's kind of like a spring, all right? But eventually it's gonna get to a point where that skin is so tight, it just can't physically stretch out anymore, all right? And that's basically your body telling us like, hey, Dr. Earle, that's about as much fat as I can take. And for, I would say, over 90% of the patients, that's gonna be less than the 2,000 cc's per side.
I had one round of BBL, but my hip dips came back.
Okay.
Would a second round be able to fill them permanently?
So the short answer is most likely yes. So that's the good news, okay? But you bring up a very common point, all right? So hip dips are notoriously a bit difficult to fully fill out in the first round, okay, for a couple of reasons. One is because the skin in that area tends to be tight. So the skin there is tighter than the skin back here, so it allows for less fill the first go round, okay? And the second reason is because the blood supply to that area is less than the blood supply to the buttocks, all right? Remember, I just told you there's no muscle there. It's a trochanteric depression. So the blood supply is not as robust, and therefore you tend to lose a little bit more fat in the hip dip area as opposed to everywhere else. So say if everywhere else you're losing 30%, in the hip dip area you may lose 50% of the fat that's transferred. But the good news is that now you've built a foundation, right? You've built a foundation so that if you come back for your second round, we can continue filling the area and really fill out the hip dip and give you that nice shape to bring out that signature upside down heart, okay? But sometimes it does take more than one round.
Doug, could you please talk about your age limit, BMI for a BBL and Lipo 360?
Right, so my age limit for Lipo 360 BBL is 50 years old, okay? And my max BMI is 30, okay? Now every doc's gonna be a little bit different, but those are my criteria, which I've developed over 5 years and about over 3,000 BBLs later, okay? That I know are gonna be safe for the patient, okay? I know that once you start getting above 50 years old, the complication rates may start to go up, and once you get over a BMI of 30, complication rates may start to go up. That's not to say that it's unreasonable not to do BBL up to say BMI of 34, and I would say perhaps age of 55. But I would definitely I would not recommend doing lipo-3C BBL with any BMI of 34 or above.
How do you determine body type versus tummy tuck?
Right, so that has to do with a couple factors. So one is the skin itself, right? Because you're thinking, tummy tuck deals with the loose skin. Of course, body type deals with loose skin. If you have mild to moderate loose skin, then the body type would be a very good option for you. But if you have kind of upper moderate to severe amount of loose skin with lots of stretch marks as well, then the tummy tuck is going to be the best option for you. But the one thing that the tummy tuck does and the body type does not do is deal with the muscle, right? So if you have significant muscle weakness because you've had, say, one large pregnancy or multiple pregnancies, or muscle separation, okay, body type's not gonna do anything for that. So in that case, you're definitely gonna wanna go with the tummy tuck. So tummy tuck deals with muscle weakness, muscle separation, and high, moderate to severe loose skin.
If a breast augmentation is want but a lift is recommended and do not want to proceed with the lift, can an augmentation still be performed?
I wouldn't recommend it, okay? You have to go with your surgeon's recommendation, right, for the best look. Because if you do the breast augmentation alone, again, you're gonna have that, it's not gonna look good. You're gonna be unhappy. You're gonna have that breast falling over the implant, and you're gonna have that, waterfall or Snoopy type deformity. So I just wouldn't recommend that. I understand, some patients might not want the lift, they might not want the additional scarring that comes with the lift. But at that point, then it's just maybe best not to do anything at all.
Do you use ultrasound during the BBL? And what hemoglobin secures that you won't need cell safe or transfusion after lipo-360? Just 12 or better 14?
All right, so it's a great question. And I could only, probably you're someone who's been recently following me, which is great. Thank you so much. But I've been using ultrasound for the BBL since 2019. I'm actually one of the first people to use this technology, actually one of the pioneers in terms of this technology. And a lot of the awareness about ultrasound BBL and the laws that are passed here in Florida have come about because of our experience, or my experience here at Pure Plastic Surgery with using the ultrasound for the BBL. So do I use it? You bet. I use it in 100% of my cases. I've been doing it since 2019, and I've done probably the most ultrasound guided BBLs in the nation, okay? So I definitely highly recommend that. And I'm happy to see that now, finally, because it became a law here in Florida, other surgeons are using it, and of course they had to be forced to do it. It had to become a law, but at least now you see other surgeons using it, you see other surgeons talking about it, and finally that's helped the safety record for this surgery. Okay, the second question has to do with your hemoglobin levels. So I personally here at Pure Plastic Surgery, again, for patient safety, I use the Cell Saver for all our patients. Doesn't matter if your hemo level is 11 or if it's 15, okay? We still want to give that blood back to you, okay? So I use it for 100% of our patients. I do recommend that as well. I don't see a reason why not to use it. It's your own blood, so you're not having any of those potential side effects from, say, a blood transfusion from somebody else's blood, right? It's just your own blood that we're giving back to you. So with the Cell Saver, I'm comfortable taking hemoglobin levels up to 11, but of course, the higher the hemoglobin level, the better. So before surgery, we highly encourage you to take your vitamin C, your folic acid, and your iron supplements to try to get that hemo level to be as high as possible. But yes, ultrasound guided BBL, Cell Saver, 100% of our patients.
12?
And our lowest hemoglobin is actually 11, but we prefer 12 and above.
I'm coming from Canada and my appointment with you for my mommy makeover is in March. I'm staying for 2 weeks.
Awesome.
Another line.
Yes.
Is that enough time to heal and travel back?
Yeah, certainly. So that's a great amount of time. I'm so glad that you're doing that. Actually, the minimum amount of time is 5 days post-op. So you're going, over what's the minimum, and that's always better for you. But yes, we have people coming from all over the country, all over the U.S., Canada, other countries, and so the absolute minimum stay is at least 5 days post-op. And then after that, typically patients can fly home. Certainly by 2 weeks, you'll be able to fly home. The good news is that hopefully by 2 weeks, both your drains will be out and you won't have to go home with a drain. So that's another, important thing there as well. The other thing that we know is that the longer that you stay before you fly back home, the lower and lower the risk of blood clots and DVTs is. So we know that within the first 5 days, that risk is too high. So it's unacceptable for you to go back home. So if anyone were to come and have surgery with us and they went home before the 5 days, they would be going home what we call AMA, against medical advice, okay? So you have to be here for those 5 days minimum. Once you get to the 5 days, it becomes acceptable risk, but of course, the more days that you're here, the lower the risk, so even better. All right, okay, all right, everybody. Well, actually, yeah, one more question.
What's going on Tuesday? Hablando español con quién?
Oh, okay, yes. So, I know typically you all know that my hump day is on Wednesday, and we'll still continue with that, but I'm going to be joining Dr. Vidal next Tuesday for her Tuesday tips en español. So, asegúrense de vernos el martes en Tuesday tips con la doctora Vidal, que vamos a hacer todo el live en español, okay? Bueno, but for everybody else, I will still be here on Wednesdays on Hump Day with Dr. Alex Earle. Ciao.